Hey, good afternoon. It's Nurse Ty with a nurse that needs a heart, and we are on episode 4, guys. Yes, like this has been so amazing. It's such an amazing journey for me, but we're going to get into episode 4. So, episode 4 is going to go into life after diagnoses, my doctors, some of my medications, side effects, and we're also going to have a special guest later on. We're going to have the husbae. He's going to come on, and we're going to talk about um, diagnoses, chronic diagnoses, or chronic conditions, illnesses that nobody really talks to the spouse or the family about how they're feeling or what they're going through. So we're going to have him on later on, and we're going to talk to him about what was his feelings, his experiences, and some of his emotions going through hearing my diagnoses. So I'm going to give everybody a quick recap. And I am Nurse Ty. I'm 40 years old, and I'm a nurse that needs a heart. I was diagnosed with dilated cardiomyopathy in 2022, sorry, 2022. And right now I am in the process of getting a heart transplant LVAD eval. And actually, we're getting closer and closer to that date. So we're going to have a lot of things to talk about this week, next week, and so going. So last time we picked up on episode 2, I talked about after diagnoses and what was going, after I got diagnoses and what my emotions were. So following my release from the hospital, I did return to work. Work was different. A lot of people don't realize that once you get something that devastating and trying to cope with everyday life, it's really difficult. But I did. I returned back to work, and I returned back to work full time with no restrictions. So I did actually work full time, work my 40 hours plus. I still was doing, my nursing duties. It was sometimes I was on a cart, sometimes I was doing patient care, my care conferences, and things of that nature. But I really wanted to talk about my cardiologist. My cardiologist that I met at the hospital that did give me a diagnosis. I wanted to talk about how great he was. I don't know if people watch episode 2, so go back to watch episode 2 and episode 1. Actually, follow me, click like, subscribe, and share. But and that I was talking about leading up to going to the hospital, I wasn't feeling good, and I kept saying that I didn't feel good, and nobody really listened to me. My primary care doctor was like, "Oh, you're a little anemic. You need some iron pills. You'll be fine." But this doctor, his name is Dr. Scott Fred. I love you, Dr. Scott Fred. I love you. He is an awesome, awesome doctor. He is a cardiologist with CCP, which stands for Cardiology Consultants of Philadelphia, and he works in the Bluebell branch. He is an awesome, awesome doctor. So, actually in the hospital, it started from being in the hospital and me telling him my signs and symptoms, the things that I was feeling, and he's the one who said, you know what? No, we're going to go a little bit deeper than just the blood work. We're going to get this and this done because it could be this. It sounds like this, and I'm so thankful that he did that. Um, us as women, we don't pay attention to ourselves, and we don't get the help that we need. And I'm here to tell women, all women, make sure that self care, self care, self care. I know it's hard when you are a wife, a mother, a sister, a daughter, a cousin, an aunt. You forget about yourself at times. But please, please, women, just make sure that you put your health first. Make sure that self care is first, because if you're not good, no one else is going to be good. You can't help people if you're not good. So I tell people all the time, make sure that you're good. Make sure that you're getting your self-care. Make sure you're getting your mammograms. You're going to the dentist. You're going to the OBGYN. You're going to see your primary care physician, and you are telling people how you're feeling. If you're not feeling well, if you feel like something's the matter, please speak up, and never, never be ashamed to get a second opinion. I've I wish that I got a second opinion a year before I was diagnosed because I felt funny, but I chalked it up to being a nurse and being overworked and being overwhelmed and just being a mom, a wife, and everything falling down on my shoulders. And I wish I would have got that second opinion. But I'm here to tell women, if you feel like something's the matter, you can't describe it, go to someone that's going to listen to you, and don't stop until you find that person. Thank God that I went, that day, that whatever happened, and God put Dr. Fred into my life that morning, and I'm very thankful for it. So we're going to get into um, my doctor's visits. So my doctor's visits became monthly, and Dr. Fred decided to increase my medications. So at this time, during my doctor's appointments, I got put on Entresto high dose, um, and that's twice a day. He also started me on a drug called lisinopril, 10 milligrams. So that is a high blood pressure medication. Lisinopril was not good for me. I had a side effect with lisinopril. It wasn't anything anaphylactic, but I had a cough. And at first, I didn't understand what was going on. I just thought that I was sick, but it turned out to be an adverse reaction to the lisinopril. So I had a cough, and it was a god awful cough. I would be coughing during meetings, and I had to tell everybody, like, no, I don't have COVID. I don't have anything. I'm sorry. I was from my lisinopril, and once I got off of the lisinopril, it did take a while for the cough to go away. So I was on lisinopril. I was also on a drug. I'm also still currently on that medication, but hydralazine, 25 milligrams. I was on Lasix, 20 milligrams, and I was on, and they had started me on another medication called amlodipine. So those were my medications at the time. And seeing Dr. Fred monthly, and he started seeing my weight increase, my fluid. I really wasn't eliminating enough fluid. So he was increasing medications, and he actually listened to me every single appointment. He listened to me. He sat down with me. He understood what I was saying. Even in the times when I couldn't really explain what was going on, Dr. Fred listened to me. So that was so very helpful into getting to the point where I am now. So Dr. Fred, my appointments lasted with him for a little bit over a year. So a little bit over a year, I went to him monthly, and like I said, my medications increased. We changed different medications. We flopped in and out of different medications and lots of medications. We tried everything, and he finally was like, "Hey, let's do a genetic testing profile." So I did do the genetic testing profile, and this genetic testing profile was to see if my cardiomyopathy came from, basically, was it inherited from my parents, or it was just something that I have. And it turns out that they could not find anything that came from my parents. I did have a mutated gene, but that the gene that was mutated, they're still not sure if that correlates with my cardiomyopathy. They're still doing testing on that. But as of right now, I have, it's not hereditary. I did not get it from either one of my parents. And he, like I said, he definitely was on top of all of those testings, and he actually came to me, when it was enough. He was like, "Hey, your case is beyond what I can handle. I need to send you to a specialist." And that is how I got down to the University of Penn. So, so that's how I got down to the University of Penn. Dr. Fred, before I was released to the University of Penn, he and I think my first appointment with the University of Penn was like 5 months out. And so Dr. Fred was like, "Hey, the way your ejection fraction rate is not improving any, we're going to go ahead and place an ICD, which is an internal cardiac defibrillator." And they did place that in. They placed that in April of 2024. So thank God that he did do that, because Dr. Fred saved my life by giving me my ICD. My ICD got placed in April, and I had my first shock of my ICD in August of the same year. So this day that my ICD went off was a very, very traumatic day for me, guys. That day I felt the best I've ever felt. I woke up that day. I was like, I had started going to the gym so this was like my second week. I was going to the gym, just walking the treadmill. I was feeling so good that morning. It was actually on August the 24th of, no, I'm sorry, August the 17th. I apologize. So it was August the 17th of 2024. I woke up that morning. I felt amazing. I showered. I made a fruit smoothie, and I was going about my day as normal. Now this day, thank God, this just so happened to be a day where me and my husband was kid free. So we were getting ready to go. He was going to go to the gym with me, and I don't know what happened. This morning he was just procrastinating. He was like, "Oh, I'm going to go. I'm going to go. I'm going to go." So I came down the steps, and went to get the mail. And on my way back up the steps from getting the mail, I felt really, really funny. I was having a palpitation. And usually a palpitation goes away with me in a couple of seconds. So when I got to the top of the steps, I felt the palpitation, but I continued to walk to my bedroom, which was 50 feet from the top of the stairs. As I'm walking, the palpitation isn't going away. I actually feel like it's getting worse. So me in my head, I'm like, okay, let me get to my husband and let him know that I'm not feeling good because I'm feeling like crap. So by the time I get to the room, I'm trying to tell my husband, like, hey, I'm not feeling well. So he said, what's the matter? And before I can get anything out, the last thing I remember before the shock was me saying, I feel like I'm about to faint. And I went to lean forward on the bed. And then I remember the most extreme pain I've ever felt. A lot of the videos that I watch on here that people explain their ICD shock, they say, there's some people that say, oh, I didn't feel anything. I felt a little sting. And then there's others that's like, oh, it's like a lightning bolt. The most of the people that I see that says something pretty accurately is a lot of the male vloggers that I do watch. It felt like a donkey kick to my chest. I definitely knew I was shocked. Um, I actually got shocked again. So as I was falling, because like I said, I felt like I was going to pass out. So as I was falling, I got shocked. Once I was on the floor, I got another small shock. It wasn't as big as the larger shock. The first shock that I received was a large shock. If I felt like a donkey kicked me, I couldn't catch my breath. I was in pain, and the smaller shock, I didn't know I was shocked again. Thank goodness my husband was there. He was there, but unfortunately, I got shocked in front of him. So it was traumatizing to me. It was traumatizing to him. Uh, I was rushed to the hospital, and they diagnosed me at that time. Is when I was diagnosed with AFib. So my heart went into AFib and RVR, which no, VR, VRV, ventricular rapid response. So um, that basically my heart was just going haywire. My heart rate was about 240 beats. They said between 240, 253 beats a minute. I didn't know what was going on. I could just tell you I felt like I was going to pass out. I couldn't catch my breath or anything like that. So I so thankful for Dr. Fred. Like I said, he implanted my ICD um in April, and then my shock went off in August. So thank goodness for him for that, because I did not have to wait. I did have my appointment at the University of Penn. I did have my appointment there before my shock. So I started seeing the University of Penn doctors in, I think it was June. So I started seeing her in June, and then I got the shock in August. So I didn't have to wait for her to do all of her testing or anything. It was already in place. And then my shock went off. So I'm very grateful for Dr. Fred for that. I'm so grateful for all my doctors, really. But Dr. Fred, you're a rock star. Actually, really like him. And he was very, like I said, he was very, very good with me. He listened to me. And he also was very blunt with me. He was very, very blunt with me, especially being a African American woman. And he let me know, like, hey, you need to do what you need to do. You have to get yourself together. You have to keep moving. You have to lose the weight, because I gained so much weight because I wasn't releasing enough fluid. So I was gaining a lot of fluid weight. And so, and just not being able to move as much as I was doing, I was gaining weight. And he was just letting me know, like, hey, you need to move. You need to do these things. You're a Black African American woman and you need a heart. He was like, these are the things that you need to do, and you have to advocate for yourself. He's like, I'm going to be an advocate, an advocator for you, but you got to advocate for yourself. So shout out to Dr. Frey. He's awesome. I love this bluntness. I love him being real with me. I loved every time that I seen him. He held no bars with me. He let me know exactly what I needed to do and how I needed to get it done. So shout out to him for that. So now we're actually going to have husband come in, and we're going to talk about the emotional aspect of the family and partner with a serious diagnosis. All right, guys, and my special guest is here. It's husband. Introduce yourself, husband.
How you doing?
So I was talking to them about my diagnoses, and that nobody really talks to the family members or the spouses to let to see what's going on with them. Everybody always asks, is the patient, are they okay? So what was your feelings when I got diagnosed?
When I first heard it in the hospital, uh, I was immediately sad.
Sad?
Yeah, because you had said something about it before, and it was like it was coming into fruition what you said. And then I went home, and I was like, well, I guess it's my turn to take care of her because the year before,
Yeah. So guys, what he's talking about is my husband just recently had a kidney transplant. So
C-section.
as he called it, C-section. That really upsets women. So he claims to have a C-section, but he had a kidney transplant. So we went through 4 years of dialysis and kidney failure with him. So I was actually on the other end of the spectrum with the being a spouse, hearing the diagnoses, going through the sicknesses. So I want to get his perspective, and then we're going to tell you my perspective of what happened when I heard his diagnoses. All right. So, um, after my first few appointments, were you skeptical about Dr. Fred, or were you intrigued as I was?
I was intrigued. He reminded me of my doctor.
Yes. So he's referring to his doctor, Dr. Rachel Hilberg, who works down at the University of Pennsylvania. So we got his diagnoses, and it's crazy, in February, same month of 2019.
Mm-hmm.
2019. So he got diagnosed. Well, we knew how far along he was in his kidney failure in 2019. At that point, they were like, "Hey, you got a couple more months until you're going to need dialysis. You're going to need a kidney transplant." So this all hit us at the beginning of our relationship. We were only about a year into our relationship when that hit.
Yeah.
I just knew that I was like, hey, I'm in it for the long haul. Like, I love my husband. So I was like, look, let's just figure out what can we do, what's going to be the next move, and how we can get through this. Uh, Nobody, like I said, nobody ever asks the spouse what they're going through, because the spouse has to watch their loved one be sick, the medications, the symptoms, the doctor visits, the anger. Nobody talks about the anger
Yes.
of the patient. And it's not towards the people. They don't mean to be mean towards their family or to the doctors or to everybody. But as a patient, me, I know that there are times where I feel like I lose myself. Did you feel like you was losing yourself during your?
Yes. I felt like the doctor's visits I had to respond every time they called me. I had to go down there. I had to drop whatever I was doing and go down to the doctor's office or go down to the dialysis center, talk with the doctors, take blood tests, new medications all the time, constantly trying to adjust. And what you said about the anger, it's people don't realize that the patient's anger is towards their diagnosis and all of the changes in their life. But the person that gets the most of it is not the doctors, it's not the kids, it's not the job, it's the spouse because they're in the closest proximity of the person going through everything.
Yes, yes. And there's times it's been times I court myself, and I'm like, why am I being so mean? Why am I being this way? But there are other times when I didn't catch myself, and he was like, hey, maybe you just need some time to yourself. Maybe you need to go do some things that's gonna make you smile. And when I was going through it with him, I just, I remember being a nurse first. And I was like, hey, I understand this anger. You're the patient, but I love you. I love you. I love you. But now when it came to me, I forgot all about being a nurse. I was like, everybody leave me alone. I'm going through this. It's me. It's me. It's me. It's me against this illness. But it's not. It's not just the patient against the illness. It's the patient. It's the family. It's the children. It's everybody that's in that close proximity to the patient that's going through this as well. So, I, like I said, I wanted to have my husband on here to let you guys know that it's not just the patient, and we're here to let you know that people need support, patients need support, spouses need support, and the other family members need support as well. They need to be checked on to see if they're okay, how they're doing, and how they're feeling emotionally. It's a lot. It is a change for everybody, not just the patient. And this is just wrapping out episode 4. And hopefully we'll have husband back on further down the line, and we'll see if he'll come back. He's real skeptical about getting on camera, guys. So thank you for coming out. Like, click, subscribe, share, and see you guys next time. Bye.